Hi, my name is Dr. Wisniewski and I want to welcome you to my channel Neoped Edu. I am a neonatologist, I am author of the book Babies Born Early, and I also write articles on my website Neoped Edu. You can find in those resources a lot of information about conditions affecting premature babies. Now, today I would like to talk about levels of care in NICU. Why is it important? It is important because depending on how severe is condition of your baby should be treated in certain ways and it should be hospitalized in the appropriate place. Not every hospital, not every NICU is capable or has appropriate staff and also appropriately trained staff with skills to treat your baby. Not every hospital will have certain consultants, certain specialists and subspecialists. Therefore, it's very important for you to know that there are different levels of NICU care, and also I want to make you aware when you should question whether your baby should be transferred to another institution, perhaps for more appropriate care, for more qualified and specialized care. And also I want you to be aware that if you have baby in NICU and doctors come to you and to explain that your baby needs to be transferred to another place, that you shouldn't be surprised about it, because there are certain conditions, requirements, and sometimes laws in certain states that require us doctors to transfer your baby to another hospital. In today's video, I will use help of the book published by American Academy of Pediatrics. You can find it on AAP website. Its title is Guidelines for Perinatal Care. The book that I have in front of me, it is 8th edition and it was published in 2017. I want to use this book because it is very important to follow the criteria very carefully and I would say strictly, because there are certain legal requirements sometimes. So I want to be really exact and give you proper information about this topic. So first of all, I want to tell you that there are 4 levels of NICU care, and the level 1 is the lowest and level 4 is the highest. So level 1 is considered as a level that should only provide care to healthy newborn babies. And by that, AAP understands that those babies who tend to be treated in those levels should be not more premature than born at 35 weeks. So, as you know, probably the due date for newborn babies is at around 40 weeks. So babies that are delivered and cared for in level 1 NICU should not be younger than 35 weeks of gestational age at birth. Additionally, those babies should be physiologically stable. Also, it is required that even though level 1 is not supposed to provide care for babies who are sicker or who are born earlier, they should be capable of stabilizing such babies and providing resuscitation measures to those babies. And they are required to prepare those other patients for transport to make sure that that transport will be conducted in the safe way. Usually level 1 NICUs are staffed by pediatricians and family practice physicians. Very rarely we would see neonatologists. Neonatologist is the name for a specialist who specializes in providing care for newborn babies, including very premature babies. Level 1 hospitals usually don't have neonatologists on site, and occasionally they will have neonatologists available by phone consult. but very rarely those specialists would be available on site. Level 2 special care nursery will be a place where we can provide care for newborn babies born at 32 weeks or 1500 grams or higher. So any baby that is weighing less than 1500 grams or is more premature than 32 weeks should not be ideally delivered at level 2 ICN. In addition to that, even if baby was born within those criteria, but baby is very, very sick, unstable, or require breathing machine or other aggressive respiratory supporting devices for more than 24 hours, those babies also should be transferred to higher level of care. Level 2 ICNs usually are staffed also by pediatric specialists, pediatric hospitalists. Often they are also available neonatologists there, either on site or by phone, and often also neonatal nurse practitioners will be available in those hospitals to provide care to those babies. Again, if a baby does not fit the criteria for level 2, doesn't mean that the staff should not be treating those babies. They should provide stabilization, they should provide resuscitation, and they should be able to have capability to prepare and stabilize those patients for safe transport to another higher level of care. Now, level 3 neonatal intensive care unit. Level 3 neonatal intensive care unit, I would say it's an optimal place for delivery of any baby that might be in trouble or any kind of premature babies. There is very little difference between level 3 and level 4, I would say that almost every level 3 can treat pretty much any kind of baby, but there are situations that baby has extremely rare condition that could be genetic or extremely rare neurosurgical or cardiosurgical condition that it's better to care for those conditions in level 4. But let's look at the guidelines, what are suggested for level 3. So level 3 should be able to provide comprehensive care for infants born before 32 weeks of gestation and with weights less than 1500 grams. And there is no lower limit. So pretty much any kind of premature baby born at any gestational age and with any birth weight, we should be able to provide care at level 3. Also, this level 3 hospitals are supposed to be able to provide prompt and readily available access to a full range of pediatric medical subspecialists, such as pediatric surgical specialists, pediatric anesthesiologists, and pediatric ophthalmologists. They also are expected to provide a full range of respiratory support that should include conventional ventilation, high-frequency ventilation, and even inhaled nitric oxide. Those are different ways of aggressive treatment for respiratory problems. In addition to that, level 3 hospitals need to be able to perform advanced imaging, radiological imaging with interpretation on an urgent basis, including CAT scans, MRIs, and echocardiography. So as you see, a lot of different diagnostic equipment need to be available there, and of course different specialists who know how to use it and how to interpret tests need to be available there. Level 3s are always staffed by subspecialists such as pediatric anesthesiologists, pediatric surgeons, pediatric ophthalmologists, and obviously neonatologists. Finally, level 4 NICU is also called Regional Neonatal Intensive Care Unit, and those level 4s are usually located within an institution with the capability to provide surgical repair of complex congenital or acquired conditions. Also, it is expected that level 4 hospital always maintains a full range of pediatric medical subspecialists, such as pediatric surgical subspecialist and pediatric anesthesiologist at the site. Those facilities also should be able to transport any newborn baby with different complex conditions to their hospital, and also they are responsible usually for providing outreach education. So as you see, there is clear distinction between level 2, level 1 and level 3. However, there is not so much difference between level 3 and 4. To summarizing that, I would say that level 4 is a place where everything can be done. Level 3 is a place where almost everything can be done. Level 2 is a place that moderately sick newborn babies and premature babies who are born at 32 weeks or higher age and with birth weight of 1500 grams or higher at birth. And level 1, basically it's a place such as birth center or home delivery where not much can be done, and pretty much only healthy and close to full-term newborn babies should be cared in level 1 hospitals. That's all for today. I hope you found this video interesting, and if you are interested in topics related to premature birth, premature babies, I encourage you to browse on my channel, to look at my book, Babies Born Early, or go to my website, neonatal.com, where you can find a lot of various articles. Thank you and bye.